Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey Angelique, how you doing?
Hey, Toby, I'm doing well. How are you?
Great, everything's going good with me. I heard you've got some viewers' questions, and let's get started with that and see what people have to say.
All right. I think it's important. We never told anybody this, so sorry, but there is an email address that you can send questions to, which is officehoursangelique@gmail.com. And I will be gathering the questions. So we have two. The first one is regarding watching a patient's face after needle insertion. And this person is saying that while they realize it's important and that they rely on the information as much as possible to assess treatment success, sometimes they don't see much and they wonder what to do. And they note that this has been more pronounced in folks that have really dark skin tones or that are pale, nearly bloodless skin. They wait and check in after a full 5 minutes to see if they've settled deeply. Sometimes they do this, but they find it disruptive. And so they're wondering what good enough is. So a couple patients seem to be wide-eyed hoot owls before, during, and after treatment, no matter what, yet there's no quote-unquote off response when they come back. Not quite sure what to make of this. So they're curious what sort of expectation you have around this, what sort of change that you generally look for to see if you go back into the room and check to make sure, and if you don't see a noticeable shift, what do you do?
Okay, what about, I've got a lot to say about that. What about from your experience, Angelique, using the face to guide your assessment?
With the face, so this will be a good segue for a story I also have. So with the face, what I have noticed myself, similar to what this person has asked, sometimes there really isn't a dramatic shift. Sometimes it's very, very subtle. So what I've noticed, I made sure to take a good look at the face beforehand. And so I'm picturing a patient in particular that comes in, their face is very pink, usually for the majority, but there's a little bit more pink in the cheeks. And I'll notice just a little bit of dispersion of that pink. That's something that I can think of. There's usually like a dispersion of pinkness. I haven't done SOM in a while on anybody that hasn't had Caucasian skin. So that my reference point to that has been mainly with that. So it's like a dispersion of pinkness that seems more even, but it's not very obvious or notable sometimes. It's very subtle.
Yeah, from my experience, it seems like you're right. I mean, with darker skin color is more difficult to be able to assess, right? The paler, the better, because you can really see the blood vessels and how everything changes in the body. Channels that I've taken that work really well tends to be an amazing change on the face, and if I've taken the wrong channel, it tends to be pretty significant. If you're like in the vicinity, if you got some channel that's okay for the patient, then there's not going to be that big of a change. So that's in general how that happens. But yeah, nothing's 100% correlative all the time in the clinic. So I've given amazing treatments that the face didn't change much. I don't think conversely is true though, like where I've gotten something really wrong and there hasn't been a big change in the face. I don't think I've seen that. But definitely I've given treatments, that end up being really powerful, really big change, but then the face didn't change as much. But I always notice a little something, like you're saying, with the subtlety, that face becomes a little bit more even colored or something like that if the treatment's good. That's the skin color too, but also like that other person was saying too, the wide-eyed things or the eyes closing and going to rest and things like that. I think that's really valuable too. Sometimes even the mouth will get really twisted if this is the wrong thing, or the mouth gets really relaxed, maybe even open and things like that if everything's going well. So the complexion is really a part of it, but then also the apertures, the eyes and the mouth, that sometimes those change too with a good treatment or a bad treatment. But again, there's never 100% correlation between those. But I feel like that's the most reliable. When I learned the system initially too, I did a lot of, would check the pulse right after and things like that. I just didn't feel it very reliable, the pulse, the changes in the pulse right away. Whereas the face is much more reliable for me. Did we hit on the whole part of that question or was it something else?
The other thing that was mentioned was, do you go in and check like 5 minutes after if someone doesn't seem settled, or do you let them rest? There is a concern about it being disruptive after someone has relaxed into the treatment if you go back in the room 5 minutes after. Just wondering what best practice is in that regard.
Yeah. If I'm really worried about the patient, I go back in 5 minutes. If I'm really unsure or I'm really like the face isn't super clear, I'm not really clear with the diagnosis, then I like to go back in 5 minutes. It's slightly disruptive, but it's really great to have that information because, right away you're going to have maybe a subtle change with the face, but within 5 minutes, you should change, the symptoms should change, the face should change significantly. You'll get more information as you get more of that, as the message you're putting in the body with the 4-point combinations gets uploaded into the body more. That 5 minutes in, then you have more information. And then that's plenty of time rather than waiting to the very end of the treatment and knowing something went wrong, right? It's great to catch it at that 5 minutes and then reverse it right then. That's great. So I agree with that person. Yeah, it is a little bit disruptive. And so I don't do that very often. But if I'm very concerned about the patient or very unsure about the diagnosis, I really like to do that. And often I'll leave the light on. I'll tell the patient I'm leaving the light on. I'm going to come back in 5 minutes and turn it off just so I can evaluate the face really well. I really don't like to turn the light off and then back on. So I'll leave it on for that 5 minutes.
Yeah, that makes sense. Can you provide some examples of what you've heard from patients, like what they say when a channel is wrong?
I'm not doing that very often lately, right? So I'm having a hard time finding that.
Pull from the vault, please.
Yeah, but really, I mean, now I feel like I don't make major mistakes, like exactly wrong channel. I can't remember last time I did that, right? But, I missed the channel, right? So I'll get something that's just okay and give them, and that will be fine. But yeah, I mean, I remember one I wrote about, right? Patient had really cold hands, so I thought it was fine to supplement heart, but they had a whole bunch of other problems. And they were saying, "Oh, I can just feel my chest warming up, and I can really feel my heart beating." And I remember thinking, assigning that to myself, "Oh, that means the treatment's really working," right? I remember thinking, "Oh, that's this power is really working." But obviously, that's way too much heat going into the heart itself. So patients will a lot of times tell you exactly what you've done wrong, right? This one, heat in the chest and then heart, becoming really rapid and being aware of the heartbeat. So yeah, that's patients will sometimes tell you exactly what you've done wrong. I'm trying to think of other things too. Like I said, usually it's pretty clear, right? Something like that. The patients won't rest and they'll start really being agitated about something. Maybe not about the sensations in their body, but they'll start getting really agitated talking about something. So that could be a sign too. Even if they're not talking directly about feeling their heartbeat and feeling heat in their chest, they just get really agitated and really talkative. It seems like that's a good case for maybe doing something really wrong.
Okay. I had an example for personally, like within the last 2 weeks, I think, where I chose the wrong channel and it wasn't super clear to me that that's what it was. So I knew, because I've been doing this now for a few months pretty consistently with patients, statistically, this was going to happen. So I was almost waiting for it because I knew, like, okay, I'm going to see the wrong channel at some point soon. I'm sure it was going to happen. And maybe I set myself up with that expectation. But this was a patient who came in that had like numbness in the hands, like very, very similar to carpal tunnel, although it was fairly sudden onset and intense for this person. And so I'm still working with this particular patient, but, and I can't remember all of the exact details to be able to give them to you in this moment. But I think I mentioned this to you in an email possibly, but I assessed her as a pericardium excess. Like, she had some tightness along the gallbladder channel. She had a lot of her sensation was running along the pericardium meridian of the forearm, and basically I misread her pericardium excess. It was actually a gallbladder excess, but her personality was one, like, she gave librarian energy, but she was a little short and a little irritable during the visit. But I still thought it overwhelmingly like she's more pericardium. And so I supplemented that. And she went from being able to close her fist fully to only being able to do this by the end of the treatment. And when I put the needles in, her eyes got really giant. And I was like, "Are you okay?" And she's like, yeah, I'm okay. And she was able to settle. And my gut was like, "Oh no." But because she settled, I was like, maybe it was just because of my new SOM needling hands. Maybe I just was a little rough, or maybe I hurt her or whatever, right? So I was like, okay, she seemed to settle and it was okay. And then whenever she came out of the room and she was like, "I can only close my hands like this," I was like, oh no. And so I was like, we'll just work it out. And she got to the elevator and she said she was able to close it a little bit more. And then when she came back in the following week, she said that she still had like this range of motion where she couldn't close her palm. I was like, oh Lord. So I let her know what the plan was. I supplemented gallbladder. And by the time she left the appointment at the elevator, she had a full fist again.
But you supplement pericardium that second time.
The first time, What am I confusing my channels? Yes. No. I supplement. Yes, that's right. She was a pericardium excess. I supplemented gallbladder. Bad. And then she came back and I supplemented pericardium and it was better. So, but her initial, like that initial, like response, like, is that something that you can take as a evidence for poor choice?
It depends
Because she
upon
calmed down.
if it's a response to that while you're needling, like when you're needling those Jing well points, right? Almost everyone has some reaction to that. But if it stays, then you could take that as a potentially a bad thing. And then usually, I notice too, like when they're doing that 3 deep breaths after you have the 4 points in, that's when if the eyes are open, then I'm really starting to get concerned. Do you remember when the eyes
Okay.
were open in that case?
They were definitely after the 3 breaths. They still were
Okay.
big.
Okay, so that's again nothing's conclusive 100% in clinic, but that's usually a guide
Sure.
that you've gone in the wrong direction.
Okay. Thankfully, we fixed it. It was good. At the end of the day.
I know, but that's really valuable. That's a
Wow.
nice thing. That's a nice thing about the system, right? If you get exactly wrong, that actually guides you what exactly you need to do next time. So it's like one of the few things we have certain in clinic, right? Is if you get it exactly wrong, then that shines a light on what you exactly need to do.
Mm-hmm. Okay.
So that case would have been interesting. Like if they're still wide-eyed after the 3 breaths, then maybe that's a good time to come in 5 minutes and check the symptoms.
Okay. Good to know, and will do next time for sure. The follow-up is all right, so I think I know the answer to this, but anyway, I'm going to ask, how often is Toby 100% sure of his treatment choice in a way that is confirmed by the patient response?
Okay, you do know the answer to that. I just say there's a Journal of Chinese Medicine article of that exact topic coming out. What was my max confidence? Do you remember?
It's 80%.
Maximum, yes.
Max confidence. Yeah, 80%.
Do you remember why?
Not fully.
Because so many times
Well,
I was
there's no 100%.
No, but so many times I was 100% sure that was a good treatment and it wasn't. So I had to recalibrate that back down to 80% because so many times I thought, oh, that's just knocked out of the park. Perfect. 100%. And then it's wrong. So okay,
I've had a couple of the experiences so far where I was 100% and was right. And so I'm watching myself because I'm trying to remember 80% because, that could happen where I'm going to be like, this is it. And then it's absolutely not it.
I mean, you'll have to make up your own percentage, but I don't recommend 100% because clinic is too confusing. There's too many complicating factors for us to really fully comprehend exactly what's going on with another human being. It's impossible. So it has to be below 100%.
That makes sense. And then the other is following up after treatments. And this person's curious about what we both have to say about this. They're a new practitioner and they deeply value feedback after treatments to refine diagnosis and to better understand the SOM system as a whole. And they say that thus far they're very slow and cautious. So it's helpful to have some time outside of clinic to process, to think through options before the next meeting without added pressure in the clinic. So wondering what systems and language that you and I use for soliciting feedback, and if this is by email or phone or only requested in cases of an unusual response, like what the best language is to use.
I want the fresh perspective. I'll give you the old perspective after that.
Okay. All right. So I have only asked for response in cases that I am wanting to really know, like if there's something big hinging on it. So the patient that I had that I was treating for the vertigo, I asked him to email me and check in with how he was doing. With the patient with the fist, the same thing. And there are other times where I tend to confuse lung and stomach in my brain. Like I know it, but then when I talk about it, sometimes I flip the descriptors. And so there's always a part of me that's afraid that I have screwed up the lung and stomach and have supplemented the wrong one. And so frequently with a lumbar and stomach supplementation, I will ask those patients to let me know as well, just in case I didn't do it right. But I don't do it on a regular basis, just in those specific circumstances that I can think of. And email is always best. A couple of patients have figured out that my work phone is textable. And so they will send text messages and then I sort of purposely delay my reply that way because I don't want to create a culture where people are expecting an instant reply via text.
Right.
So email is preferred. If it's like a severe thing, then a phone call. Yeah, that's my order of operations. So what do you do?
I'm just thinking about what I do for new patients, right? I don't give them a follow-up appointment usually until they checked in after 2 days and give me really clear feedback about what's going on with them. So I sort of make it as a gateway for them to get further appointments to make them check in with me about 48 hours after the treatment. And they'll talk to my office manager directly on the phone or text or email. I give it up to them however they prefer. But I feel like this is really valuable because it forces feedback from them. And the language I use is I say, I'm trying to think about the exact words I use, but it's like, I'm going to figure out your treatment plan going forward based on this feedback. So I need it to be really clear. I don't need everything in the real details, but any significant changes that you've noticed in the last 48 hours, I'd like to hear about. And so that's usually what I do for that. And then I say the same thing too when the patients come back, right? I say, "Oh, how have everything been going with you?" And then sometimes they'll kind of hem and haw about stuff, and then I'll reiterate that again. I'm going to make a really important clinical decision based on your feedback, so just make it as clear as possible for me. A lot of times patients don't know how seriously we're taking what they have to say, and so it's nice to give them that framework, and then they kind of steps up their meticulousness of giving that feedback. That you're really eliciting it, and you really need it as clear and as honest as possible.
Okay. So what do you do? I'm sure this happens sometimes with patients that are like, nothing is different. Nothing changed.
Yeah, but then I
email
ask
back, "Dear Toby, no changes."
And then sometimes I'll ask back. I'll either have my office manager ask back, oh, that shoulder there's been no change with the shoulder. I look back in the chart, all the things that we're doing, no change with the shoulder, still having that diarrhea 7 times a day, whatever it is, right? And go down the list just to remind them of their original report, because that's really common for patients to say there's no change. I made a small video about that. I'll try and put it, if I can figure out how to do it, I'll put a link into this one about that, about the patients come back and reporting no change, and even though there's been significant change. I feel like, again, they're not great reporters sometimes, and especially that's the most common way of not giving good feedback, is saying everything's fine, everything's the same.
Yeah.
And so then
Yes.
a lot of times I'll break that down and be like, oh, so really 7 times a day diarrhea anymore? And then you'd be like, oh, well, that's fine, but something else is still lingering.
But that's because the sun's out.
Yeah. In that video. Okay, I'll send that. I'll really try and put this video in here because that was again. And then a lot of people want to blame acupuncture for the worst possible things and then not giving any credit. I think that's maybe just a cultural bias or something like that. So just be on the lookout for that. Acupuncture can cause so many side effects and so many harms and things like that. Recently, I had a patient contact me, all this crazy bruising on their body, and I checked their point combination again. I gave them nowhere near that bruising. So I forget where, they'd been doing something else that caused the bruising. But again, everyone's immediate thought is, oh my God, it's the acupuncture. So just be on the lookout for that.
Yep. Then, so along those lines, so the patient, I don't know if I talked about him a couple episodes ago, that had come in with the vertigo. So it's been a month since I last saw him. And he came in this week for his appointment because he said he would come monthly. And he basically said, he's like, I feel better. And I was like, okay, you feel better? He's like, yeah. I'm like, well, what does that mean? Well, I mean, I still have to look where I'm walking, because otherwise I feel unstable. He's like, but I don't feel dizzy. And I'm like, that's great. He's like, but I'm not eating gluten. And I said, great. He's like, I tried eating gluten. He's like, I tried it one time. And he's like, and then I had an episode where I thought I was going to get vertigo again. He's like, but I was able to catch it. And I'm like, that's great. And how's everything else going? Everything else is fine. And it was almost like he didn't remember the things that he came in with. So to speak to like what you're saying, I ended up going all the way back again because I had done this with him the first time. And I was like, well, how are you sleeping? He's like, oh, I'm sleeping fine, no problem. And the most recent time that I had treated him, he couldn't sleep at all.
Right.
Like he had gone from being able to sleep to doing a diet change and having acupuncture, not being able to sleep, and then able to sleep again with no problem. His digestion, so much better. All the things were so much better. And then he goes, I think I'm going to come back one more time and just see if this is worth it. And I was like, okay, sounds good. Let's do your treatment. And so for him, this last time, I supplemented stomach because he was having lung excess symptoms, damp on the inside because he was having looser stools. Like his bowels were better, but he was having looser stools, and his skin was dry. It was a little bit of a stretch because it wasn't like moist skin, but it was dry on the drier side. But yeah, it was pretty funny going back and being like, so this is pretty much better, right? This is better. And then he's like, well, how do I know? I mean, how do I know it's really the acupuncture that's doing anything? It's like, okay, come back next month and we'll see how this goes. So
Yeah, I mean, you could always
So
put
I
that back in
update on
his.
that one with regard to that.
Yeah, you could always put it back in his court and just be like, oh, well, don't come for a while and then see how you do, Because, I mean, there are so
Yeah.
many variables in the patient's life, so you could remove yourself as a variable and see how everything goes. I think that's a reasonable experiment. And
So
then
he's
I just
coming
want,
back and he came back a month later and he's going to come back next month as well.
he's going to demand to come to see you weekly once he recognizes how much you're helping him.
We'll see.
One more thing in defense of the patients, right, is the body's designed to register problems. If everything's going well, it just doesn't register it. So that's in defense of why the patients say that, right? If it's not happening, then it's out of your consciousness. So yeah, that's a little bit understandable what they're going on with them. That's why it's so nice to be able to consult your notes again and then say it back to them.
Yes. Taking good notes is a solid thing to do.
Yes, or a good
Yeah.
memory. Yeah.
Yes.
All right.
So those are our main questions.
That's way to go, listener. Thanks.
Yes,
One
thank
thing
you.
I was going to say too, I have just a little bit of Chinese medicine news. I'm not sure if you heard about it, but we lost another Chinese medical school. Did you hear about that at Emperor's College in Santa Monica?
I didn't hear about that.
Yeah, maybe 6 weeks ago or so now. It's been there for 42 years. One of my good friends, he's a colleague, she went there and pretty upset about it. So it's definitely not it's not by chance these things are going down. This is definitely a trend that 6 Chinese medical schools in the last 2 years have closed. A little bit concerning. I still don't know exactly what the solution is here, but this profession has to figure it out probably.
Well,
So
I know that there have
go
been
ahead.
several absorptions of schools into other schools, right? Too. That's happened.
Yeah, this one just closed, as far as I know.
Like this one just closed, so there was no absorption.
Yes, gave the students just a couple week notice, right? Just that this is it.
God, can you imagine being in the middle of acupuncture school and then getting the announcement of, guess what?
Yeah, not really. And then I think it must
Goodness.
be, a lot of acupuncture students in all the schools must be a little bit nervous right now just because it seems like the hammer's coming down a lot of schools. So, yeah, again, I don't know the solution, but probably something, right? I think this has been recognized for a while, right? Chinese medical school prepares you for the exam, but not how to practice, and it's really expensive. So that's just they're not making a very good product. So hopefully, again, I don't have the solution, but hopefully someone in the Chinese medicine community can come up with an idea for a school that can make a better product at not such crazy prices. So I'm hoping that happens. Otherwise, as Chinese medicine gets more and more demand and we have less and less schools, that's going to be a big problem.
Yeah, I wonder, goodness, I wonder what's going to happen. Yeah,
I was going to switch to another topic. Are you okay?
sure.
Okay, well, this will be our final topic for today. But do you use AI for anything?
I have.
What kind of things?
What I have used it for is since I am documenting for insurance companies, and also I had a patient that was sort of wondering along the same lines of like, is this actually helping? I removed the identifying information and I cut and pasted my visit notes for like 4 sequential treatments into it and had it analyze the symptom, like basically create like a symptom tracking thing for me. So like visit 1, pain was 7 out of 10, able to, put socks on with difficulty, like basically track all of my measures across the continuum of the visits and to create a synopsis. And then I double checked it to make sure it wasn't wrong because I don't think AI is right all the time. And then I was able to use that visit note both for the patient, just this note, like the breakdown, and then able to put that in the chart as evidence for supported continued treatment and another treatment plan.
That's awesome, right? Again, that's so great for
Yeah.
those kind of analytics, right? Where you can pull up trends and it
Yeah.
can, especially looking through big text, it's so great for that. Other things you use it for?
I have double checked my diagnoses out of curiosity to see, like, okay, this is what I think. I wonder what it thinks. And it's close. It's not the same, but it's close. So I've dabbled in it curiously. I
That's
haven't
great.
like done what it's told me to do, but it's mirrored back elements of my own diagnosis and elements of my own point prescriptions if I'm not using SOM. It's not good at SOM because I've tried to see what it would say and it looks at it differently than you do. It uses a language not that you use. And so maybe
Yeah.
it's saying something correctly, but it doesn't. It's more 5-elementy in its language versus talking about like the excesses in the channel systems.
It probably doesn't have enough data, right? To be able to come up with something good for that.
Yeah.
Can I share with you a prompt I heard from a Stanford professor? You might like it.
Sure.
Okay, great. This is, I'll put it up here on the screen and I'll email this to you so you
Okay.
don't have to remember, but it's a great prompt.
All right.
What do you usually use, like ChatGPT or Gemini, Claude? What do you like?
I've used ChatGPT.
Okay. You can ask this to all three. I use all three systems. It's pretty good to get a little bit different take on everything. But this is the prompt. You ask it, can you ask me questions one at a time until you have enough context about my workflows and responsibilities and objectives, until you can make two obvious and two non-obvious ways I can leverage AI in my work? I think you'll find a really interesting back and forth with the AI if you do that prompt.
Cool. All right, I'll check that out. Okay. Thank you.
And then AI asked me, I asked it if there's any questions I should ask you. I described our show and asked if there's any questions I should ask you. And then it gave up one topic idea for us to discuss: acupuncture needles, tiny torture devices, or miracle wands. Do you have any response to that?
That's pretty good.
That was pretty good. Way to go, alien intelligence. Okay, then it had other
tiny torture devices. Well, in my hands, it might be the former. In yours, it might be the latter.
I don't know if that's true, but that's a good response. Okay, I'm going to ask. I'm going to ask you some other questions too. Okay, I don't want a response to this, but I thought it was funny it came up with this. It wanted me to ask you, what's the weirdest thing you've ever stuck a needle into? Okay, I thought it was funny. If channels were a party, which one would be, describe the party that they'd have? If all 12 channels went to a party, what would the channels look like?
If all 12 of the channels went to a party, what would that party be like?
Yes.
It would be something else.
Okay. Okay, that's pretty good.
Sorry, I couldn't help myself.
Yeah, okay. They wanted me to ask you, what's more terrifying to you, a chi blockage or someone who just Googled TCM cures for everything and now thinks they're a practitioner?
Obviously the latter.
Okay, a chi blockage is no worries. It's someone that, yeah.
Chi blockage is all right.
Has done all the research on Chinese medicine and then now would like to present it.
Yeah, well, what's interesting is the patient that I ended up going to AI to help me with the consolidation of data was someone who was unsure if the treatments I was giving to them were scientifically valid because I wasn't repeating the same points every single time. And so they weren't sure if they were able to accurately track because they couldn't quite understand exactly the reasoning behind it. Like they were definitely looking at it like the Western reductionist way of double-blind, randomized, repeatable. And so I had to go into a detailed discussion with them about Chinese medicine in general. But I think it's because they had gone down a little side rabbit hole of their own in that. So very on point and valid question. Thank you, ChatGPT.
Thanks so much. It was great questions. And then also, remember when you start working with AI, right? Just keep iterating, make it iterate. Because first I said, what question should I ask you? And it was like, how's holistic medicine perceived? And, like a whole bunch of boring things. And I kept asking it.
Yeah.
I said, I think the last thing I said, make these questions slightly irreverent. And it did. That's when it started doing the parties and everything like that. So I thought it's pretty good. But don't, like you were saying before too, don't just accept its first thing. Ask it to explain itself and make it a little bit better.
Yeah, you've got to have it double check for sure.
Yes.
What do you say to folks that are like, this is the devil? We should not be using AI in Chinese medicine.
I was in that camp, and like both of my books, right, I like proudly said did not use AI for any parts of it and things like that. And now I feel like it's just a tool. It's a tool. Actually, I read recently you should think of it not as a tool, but like as a teammate. I think it's reasonable as a teammate, to run things by it. Like I said earlier, right, you all know Harari, he calls it alien intelligence. So it's nice to have another intelligence give you a little bit of feedback that you can't do yourself, right? Just something on the outside. So I think it's good. Again, I think as this goes forward, this is the probably golden age of AI right now. And then I'm reading a little bit about this right now. I think very soon this world's going to get a little bit weird with AI. So might as well use it while it's still at this infancy stage, because as it gets weirder and weirder, I think we're going to have a harder time interacting with it. So I feel like this is the time to get used to it and see what you can do with it. Later on, I'm not sure what kind of directions this is going to go in.
I have heard that there's one that they're developing specifically for Chinese medicine called Chibo. Have you heard of this?
No, I had a similar idea initially, but I'm not sure how to do it. I think the thing you really need is to make it really reliable. And so, like, if you can just train it on really reliable information, I think that's super valuable. But I wasn't sure, like 2 years ago when I was looking into that, I wasn't sure how to do that, how to make sure it was super reliable. Because when you give recommendations to practitioners, right, there's a patient's basically life involved in that. So you got to make sure it's really correct. So I kind of shied away from that because I didn't feel like there's a good way to, to avoid the hallucinations, to avoid the errors and things like that. What do you know about that Chibo app? Anything about it?
The only thing that I have read about it was an article, and then I tried to find it and I couldn't find it, but that it's basically an AI specific to Chinese medicine, that they're inputting all of the patterns and classics and all the things into it for the utilization by clinicians and students. And it's originated in China, I think. It was a really brief article that I found. That's the extent of the rabbit
Okay.
hole I went down, very shallow rabbit hole.
Okay. Anyway, it was nice to know things that are
Yeah.
coming down the pipe.
hmm
All right.
I'm with you. I think it's a good tool. I don't think it should supplant our brains, but I think it's interesting to bounce things off of it.
Right. That's how we get better. Like you were saying, starting with earlier, that feedback from the patients, that's how we become better clinicians, but also for like our writing and everything we want to do, right? It's nice to bounce it off something. So again, I spent a lot of time like stiff arming it and keeping it away. And then when I started working with that, I thought, oh, this is not the devil. This is, yeah, like I said, a potential artificial, like alien intelligence to give us feedback. And that's valuable. Again, you have to just take it as feedback, not as gospel. I think that's the worrying part.
Yeah, I agree.
All right. Let's wrap it up for today. And then thanks so much for soliciting feedback from anyone who's viewing this. Right, it'd be great to any other questions or any feedback if they can send to that email, and we'll just keep working on
Yeah.
making this better and better as our conversations get better and better. Hopefully, that you can get more and more out of it. All right. Bye, everybody.
Yes. All right. Take care, everyone.